Hey, good morning.
All right, so the individual mandate, I thought they were talking about taxes. What are they going back to the Obamacare for?
Well, you've got the Senate, who has these strict budgetary guidelines. They've got to keep their bill to a deficit increase of $1.5 trillion, and they needed to shave a couple $100 billion off of their bill. Well, guess what? The Congressional Budget Office has said if you repeal the Affordable Care Act's mandate, that would actually save you more than $300 billion right there. President Trump heard about that. He started tweeting that that's what they should do, and in fact, yesterday, you had Senate Republicans propose to get rid of that mandate as part of their tax overhaul.
Which is interesting because the idea is what? That if you don't force people to buy health insurance, some people won't buy it?
Well, yeah, it's interesting here in that you've got two different things that people are thinking about here. One is money coming into the government's coffers. Remember, right now, you've got millions of Americans that have decided not to buy insurance, and they have to pay a penalty to the government. So you're actually giving up on some of that revenue. However, you're going to have a lot of healthy, low-income people who decide, you know what, I don't want to buy health insurance. It's not worth the money to me. A lot of those people are already getting subsidies from the government to pay for part of their health care plans. Well, all of a sudden, the government would not have to pay those subsidies. The CBO is also saying that that would probably raise premiums on everyone else. So all of a sudden, you're going to have other healthy people who are kind of like, it was worth it to me, but now that my premiums are going up, it's not anymore. So more people leave the marketplace, and you get into this vicious cycle. Eventually, the Congressional Budget Office says 13 million people would end up going off of health insurance, but it would save the government a couple $100 billion.
Why would anybody, and I know, Brett, I know you're the reporter, and I'm asking this to you, but this is the question to them, and that is this. Why would anybody buy health insurance if you don't have to buy it? And since there's no pre-existing condition requirements, I can buy it the day after I'm diagnosed with cancer.
Yeah, this was the debate during the Affordable Care Act debate. Remember, the individual mandate is extraordinarily unpopular, and that's because it basically asks things of people who feel like they don't need it. But the linchpin here was twofold. One, you're looking to keep healthy people in this marketplace because they lower premiums for everyone else. They increase the pool of people that have insurance. That means sick people aren't paying astronomical prices, and it makes sure that even healthy people who can get sick, it turns out, would have some sort of health insurance in case of an emergency. That was why Democrats pushed through this very unpopular provision, and why they say it really holds the entire structure together.
And there are going to be then some people, higher-end middle-class people who are going to be getting a tax increase, as well as their health insurance premiums are going to go through the roof. Doesn't sound to me like a very good tax cut for some people.
Well, and it's risky for Republicans, and we've seen this before in that John McCain, Lisa Murkowski, and Susan Collins all decided to vote against the so-called skinny repeal. You remember the famous thumbs down. We have not received an indication from them what they would vote on this tax bill, but it would take a big about-face for them to all of a sudden decide, yes, we are going to get rid of the individual mandates. Now, John McCain said his problems were mostly about process, about shoving that health care bill through at the last minute. So it's possible that he could change his mind. But all of a sudden, Republicans are going to be dealing with a very energized Democratic base that want to see this thing torpedoed. Before, it was a pretty sleepy discussion about taxes.
So the Senate, this is definitely in the Senate proposal, right?
Yeah, that's what the Senate is putting in through their bill. It's possible. It's not right now. It's not in the House bill. The House bill is actually further along. But it's possible that you could get House Republicans who are, downright giddy at the idea of repealing the individual mandate, that they could even add that to their bill this week.
Stay tuned. Brad Mielke, thanks for checking in. Good stuff.